Osteopathy comes from actually an MD, Andrew Taylor Still, during the American Civil War, which was the late 1800s. With osteopathy, you have an approach with your hands to general medicine. When I say general medicine, I mean not the medicine pills. I mean, my day is things you would expect from manipulation. Back pain, neck pain, headaches. And I go to shake his hand. The tongue comes out of his head. He's crushing my hand. He's in a full body spasm. And I won't say on camera what in my mind I say. Back pain is the #1 reason why people see anybody.
No.
Osteochiro, acupuncture, back pain. Have you ever had a kidney stone?
No.
You're lucky.
What is the impact of poor mental health on the body? Is there a correlation that you can read in osteopathy that a person is suffering through something in mental health?
If I break your body, you can recover much easier than if I break your mind.
Tell me more about osteopathy. How does it work? How do you get the information?
My approach, and it's an old osteopathic approach, is I'm going to look for other things that don't feel right in your body, not just what you're complaining of today. Approach means you have something you might be able to offer them. You might be able to help them. Sometimes medicine, and I'm not saying medicine is bad because I'm trained in medicine the same, but sometimes if they don't have the answer you want, the answer is there is no answer. You can't separate the emotions from the physicality.
Hello, Dr. Stephen. Welcome to the Gut Feel Show. How are you doing?
Fantastic. Thank you for having me.
And I am really excited for this topic that we are covering up today. I would like to, because this is a term which is very new for a lot of people in India. I want you to start with explaining osteopathy a bit. What is it? Just define it a bit, then we'll dive deeper.
Okay. Osteopathy comes from actually an MD, Andrew Taylor Still, during the American Civil War, which was the late 1800s.
Okay.
In that time, Dr. Still lost some children to meningitis, had a brother-in-law that was hooked on what they called laudanum, would be like morphine today. So medicine didn't really offer a lot that he still lost family members to it. And yet he had another, he doesn't say he invented osteopathy, he said he discovered it, meaning that it was always there. And he had a very spiritual outlook on this. You would have to, after having family members die, and then doing something productive. So he studied anatomy and physiology and developed his style of manipulation. First of all, drugs in those days, they were mostly either fake or they were poisons.
Oh.
If you had surgery in the 1800s, probably you'd die from gangrene. So traditional, when we say MD medicine, there wasn't much to offer it. So this is how it started, as a manipulation. Not that, again, that they invented manipulation. Manipulation's been around for thousands of years in every culture.
True.
But we certainly have our own viewpoint on it and a different philosophy.
Okay, very interesting. And I want you to also elaborate on how to differentiate. Like a lot of people misunderstand it with physiotherapy. Can you give us an explanation how they both are distinctly different?
Sure. Well, you have a lot of different words that are floating around this country now. So other people will be better to speak about the ins and outs of physical therapy because I'm not a physical therapist. People in India here that are practicing osteopathy and most of the people that I'm involved with around the world are physical therapists first, which is a good substrate to begin osteopathy because they have a good understanding of how the body works as well as a palpatory experience. The MDs don't really have a palpatory experience. However, the answer to your question, I'm an American osteopathic physician and surgeon. So I'm not like other people that you may meet in Europe and so forth, where they are either going from high school to osteopathic school or perhaps PT or some other education and then going to osteopathic school. In America, osteopathy is medicine. I went to 11 years of school. I delivered babies, did surgery, prescribed medicines, as well as manipulation. So myself is a different example than many that you will run into. So it comes from a very deep understanding of medicine and a philosophy. He still had a different philosophy. 3 important philosophies. He said the body's a unit. Well, when I graduated medical school, everyone was saying, we do holistic medicine. It just became something to say. And you go to Dr. A, Dr. B, they're all doing the same thing. There's nothing actually holistic about it. When we say holistic, I'll give you an example. I'll give you a quasi-medical example. I see people, because my license is general medicine, I would see people that would have these problems in some cases because they're seeing this doctor, that doctor, that doctor, and everybody's adding pharmacy to them. No one's really talking about anything. No one's considering how the effects are working on the rest of the body. Now add to that a physical modality. A physical modality, if you are touching people's bodies, very often you'll find other deleterious conditions before the medicine people find it, because we're palpating. A lot of times in medicine we're not seeing it till it's gotten very, very much more serious. So the body is a unit. That was one philosophy. The other one, second one, was that structure and function have a relationship, meaning that your body is built a certain way. It's probably that way for optimal function, not just randomly that you're built that way. This should underpin the techniques that we're going to create. Third philosophy is that the body has the ability to heal itself.
Yeah.
And I tell my students, if you don't believe that, you're in the wrong class, listening to the wrong guy. What I don't get involved in is the spiritual aspect of why is something terrible happen to a baby. That's something you can consult whatever your faith is or isn't. That's not a question for me to answer.
Understood.
Those things. However, with osteopathy, you have an approach with your hands to general medicine. When I say general medicine, I mean not the medicine pills. I mean, my day is things you would expect for manipulation. Back pain, neck pain, headache, and so forth. The other half of my day are just bizarre things where no one else knows what to do. Autistic kids, severe neurologic problems, genetic problems, cancer. I'm not saying I have a cure for cancer, but if you're going to look holistically at the whole patient, it's quality of life.
Yeah.
Maybe you'll extend their lives, maybe not, but you can change the quality of life.
Yeah.
Sometimes medicine, and I'm not saying medicine is bad because I'm trained in medicine the same, but sometimes if they don't have the answer you want, the answer is there is no answer.
Yeah.
Now you asked me a bigger question, so I'm just going to prattle on about that. Okay, physical therapy is often very protocol driven, which is fine. You have this condition, here's the things that you should do for that kind of condition. We have that in medicine for everything. You have this condition, here's the surgeries, here's the remedies. Chiropractic has become a very popular thing in this country as well. We also do, I don't want to say we do chiropractic because we were before chiropractors, but to be fair to them, people have been cracking backs and necks for thousands of years, long before chiropractors, long before osteopaths. I want to mention something about that because we have a different philosophy, generally speaking, and that is, I'm not in the habit of treating well people for no reason. And there are other people within my profession, within chiropractic and PT, which it's just business as usual. You come in, do you want the gold plan, the silver plan, the super deluxe plan? How healthy do you want to be? Okay, and I've seen this approach across many professions, not just one, and it really turns me off. There's enough legitimate business. We're in business. There's enough legitimate business for helping people that need help, not addicting people to the idea of coming to you forever or scaring them with, I've heard this exact statement, well, how healthy do you want to be? This is bizarre, okay? So I wouldn't give you digitalis as a vitamin. I'd give you digitalis because you have a heart rhythm. But yet in our field, in manipulation of any title, people are selling it a lot like a vitamin.
So it's unethical manipulation.
It's a what?
Unethical. It's quite unethical.
There's a lot of unethical things, okay? We could go into things that might go into politics, which I'm not going to do here.
I know.
Because
but these are things that are actually happening. What you were saying.
Yeah,
like
I mean, look at follow the money, and then you'll find a lot of
the wrong path.
A lot of dark doors.
Dark doors. Yeah. Tell me more about osteopathy. How does it work? How do you get the information through the hands?
Okay, I'm going to tell you how I get the information to the hands. I'm going to tell you how other people get the information to the hands. I'd say most of the world works in a protocol-driven kind of way. Tell me what happened. Tell me about the accident. How did this happen? Where's your pain? Describe it to me. And then we start taking that like you put it into a computer. Here's what I might do for you. And that is helpful for a lot of people. That is across osteopathy, medicine, chiropractic, a lot of professions, that idea. There's a much older idea of palpating your body and feeling where things feel wrong. We call it key lesion. And what I mean by that is if you came to me and said, Dr. Sanet, my neck hurts, I got in this car accident, blah, blah, blah. Okay, I'm going to find something in your neck to treat. Everybody's going to find something in your neck to treat. Everybody's going to look at the x-ray and read the same thing.
Yeah.
No new information. And maybe that's enough for you. I'm going to look at, I'll read the medical studies, I'll weigh them on a scale, see how much paper there is, and then I'm going to put my hands on you and forget everything that I read and see what feels wrong in your body. And what I mean by that is, my approach, and it's an old osteopathic approach, is I'm going to look for other things that don't feel right in your body, not just what you're complaining of today. A short example, if this shows up on camera, is if I twist my vest like this, maybe you're telling me you got pain up here, you got some pain down here, but I feel this. You don't have any pain there, so you can't tell me about it.
Yeah.
But it feels wrong. So palpation, the two work well together. Palpation is an art. Learning protocols is more a science, if you want to say that.
Can you elaborate palpation?
Sure. Well, I'll give you this example, and I'll drag you into this personally. But you're a young guy. Have you ever had a kidney stone?
No.
You're lucky. I had one, and at 3 o'clock in the morning I woke up, and I won't say on camera how I felt, but I was over at a friend's house, actually sleeping over at a friend's house. I crawled over to his bedroom, and I said, take me to the hospital. He said, why? I said, either I'm having a heart attack in my buttocks, or I have a kidney stone. I believe that's a PG word, we can say it, or you can edit it out. They took me to the hospital, and I get a young doctor, it's a young lady, and I said, look, I'm a doc, I got a kidney stone, let's get the pain control done here. And she's going through everything properly the way she's supposed to do. And she starts to walk around the table. And I turned right around and said, no, don't touch me. Because I know what she's going to do. She's going to go and bang on my back to verify that I have a kidney stone. So she'll bang on my back, I will scream, then she'll write down probably kidney stone. This is really a gross idea of palpation.
Oh my God.
I've caught patients that have had kidney stones, gallstones, somebody with a hemolytic lung was bleeding into his lung. I've caught this by just subtle light palpation. I'm like, you know what? You're telling me your back hurts. I think there's something wrong with your lungs. You want to go to the ER. Let them check you out. I found that without banging on people and without them barfing up blood, being to that point. Now, that's not an easy skill. Okay, you don't fall into that.
I'm sure that's a very
You don't fall into that, but a lot of things can be felt. If I felt that, I felt, you have this disease going on, I send you to the hospital, and they go, you know what, it's nothing. Patients aren't mad at me. I make an error on the side of safety. But a lot of times I sent them to the hospital, there was something going on. And a lot of people that I have trained, people who are PTs that have then learned osteopathic skills, they'll tell me the same stories. I said, you may find the disease before they have to get to the MD. It's not that the MD is dumb, and I'm not suggesting that. It's just you're feeling something from palpation that doesn't feel right to you.
What is that you feel? I'm very curious.
I'll give you an example. Can I give you an example?
Yeah, please.
Okay, here's an example. When I was on my fellowship program, back when I was young and had black hair and was slightly better looking, I was working at a clinic. I'm still a student. It's an undergraduate fellowship, and I'm in a general medicine clinic. It's like a McDonald's. There's 2 doctors, a couple of nurses. We have our own lab, and 150 patients are coming through a day. So, because I do osteopathy, the doctor who's in charge of me, oh, okay, here's your room. Because who comes into general medicine? Diabetes, earaches, coughs, colds, blood pressure, and back pain. Back pain is the #1 reason why people see anybody.
No.
Osteochiro, acupuncture, back pain. Okay? He gives me this guy had a car accident. He was cleared from the hospital. It was a week ago. I treat the guy. It was on a I do believe, I'm pretty sure it was on a Tuesday. I said, I'll follow up with you on Thursday. We'll see how you're doing. This was 30 years ago. I treat this guy, he's all busted up from a car accident, but he's a young guy, strong. I treat him Tuesday, he comes in Thursday. I didn't think he'd be this good. I thought he'd still be kind of busted up and not good. He comes in, he's feeling great. I'm like, oh, okay. I got lucky, or I'm better than I thought I was. Okay, you know what, buddy? I'll check on you next week. This is Thursday. Friday morning, clinic opens up. He's waiting in there. He's reeling in pain. Reeling in pain. Now, I'm a medical student doing a fellowship program, which means I'm doing another year of manipulation, but I'm not graduated yet. Well, this makes me nervous. I don't know what's wrong with him. So I go to look at him, and I palpate him, and I go, there's something wrong with your lungs. I don't know what. Okay? So I go to my boss, who owns the hospital where they went. And I said, Kevin, there's something wrong with him. Can we send him to the hospital? No! Just go in there, do what you do, get him happy, and get him out of here. You know, medicine's a business. My boss is an uber-rich guy.
Oh.
So, and I'm kind of stupid. You know, I'm a student as far as medicine. So I go to one of the other people in the clinic, he's not a physician, but an advanced nurse. I said, Carlo, man, this guy's scaring me. I don't think that there's something wrong with him. What kind of thing can we do to test him? He says, hey, man, do a VQ scan, man. He's from Cuba. That's the accent. Do a VQ scan, a ventilation perfusion scan. I don't even know what it is. So I go to my boss. I'm like, Kevin, can we do a VQ scan on him? He goes, get the hell out of here. You know how expensive that is? He owns the hospital, so they don't want to spend the money, right? So get out of here. He says, go in there, turn on the lights, do whatever it is you do that makes people happy. So I go in for the second time. I just don't feel right about it. Whatever I feel, it's creepy. It doesn't feel like what tissues normally feel like. There's a normal feel to things, and then we would use different words to describe spasm, fibrosis, rubbery, or just something that tells me this guy's sick. I go in for the third time. I said, Kevin, can you come in and listen to his lungs? Because I listen to his lungs. I don't hear anything. But, you know, I'm stupid, so maybe I missed something. Carlos listened. He didn't hear anything. I said, Kevin, come and listen. He comes in. Okay, sir, you're fine. Dr. Sanet's going to help you out. And then he tells me, get this guy out of here. I go in for the third time. You know what? I'm not going to do it. I start to get mad. That's how I work. And since I treat my boss, his wife, and all the other doctors, I have a little bit of clout. I said, you send him. I'm not going to do it. I said, there's something wrong with him. He's like, okay, calm down, calm down. We'll send him, okay? Sends him to the hospital. I get a call on the weekend from his wife, who is a dermatologist. Hey, did Kevin call you? No. She says, you saved that guy's life. I said, what happened? Well, he had a cracked rib that didn't get picked up on the x-ray. I guess it was very light. He was feeling so good, I told him, just relax, I'll see you next week. What actually happened was, he was feeling so good, he decided to paint his house. And those big 5-gallon cans of paint, he cracked the rib that was partly cracked that everyone missed. Me, I could miss it. I'm a medical student. But the hospital missed it. So he cracked the rib, it punctured his lung. So when he's coming in to see me in the morning, blood is leaking into his lung. Now, I didn't hear it. The other advanced nurse didn't hear it. My boss didn't hear it. By the time we got to the hospital, he had 1 liter of blood in a collapsed lung. He would have woke up dead the next day. Now, I was just a student. So I'm not saying I'm so smart. I just trust what I feel. So if I send him to the hospital and it was nothing, okay. I'm going to make an error on the side of caution. We should make sure we don't make a mistake.
So how do you do that is making me more and more curious. Like, is it a different body type that you have that you can read, or you can learn it?
I don't challenge what I feel. When I feel your body, I could teach a child to do this. You and my colleagues here would be more difficult because they know too much. Kids don't challenge anything.
Yeah, kids don't challenge.
I'll drag you into this. Do you have children?
Yes.
Okay.
3.5-year-old.
How old are they?
3.5.
Okay, you're not at the pain stage yet. You're at the stage where you can't get the truth out of them, but you're not at the real pain stage.
Yeah.
I'll give you an example. 7-year-old kid, if you have 3 kids, you come in, the glasses are broken and on the floor. Who broke it? And nobody speaks Hindi.
Yeah.
Nobody understands what you're saying.
Yeah.
They all know who broke it, but nobody knows. You know what? You have 1 kid and it's broken. Well, we all know who did it. Get over here. No. Okay, look. Daddy's happy, see? Daddy's happy. Come over here. You got to chase him all around the yard.
Yeah.
Oh, why? How does he know? Is it because he's smart? Has nothing to do with that. They don't challenge what they feel.
Yeah.
I don't challenge what I feel. I have plenty of medical knowledge to go through and try and understand what's going on with you. But I don't challenge what I feel. And I spend a lot of time learning how to really feel. If you're a musician and you play music, and I have friends that play different kinds of music, guitar and whatnot, and if I go to a show with them and somebody's playing, I won't hear these little nuances that they hear. Oh, he's not playing well. Oh, I'm like, really? Sounds fine to me.
Yeah.
But I don't play guitar. Rachmaninoff was a classical pianist. Rachmaninoff said, if I don't practice for 1 day, he said, I know the difference. He said, if I don't practice for 2 days, my trainer knows the difference. If I don't practice for 3 days, the whole world knows the difference. So there's different levels of palpation. I don't ignore the information that is given to me, the medical information. I look at it, but there's more to you than just, doc, my neck hurts. There's my neck hurts, but my back hurts sometimes for a couple of years, but I'm not really here for that. I hate my job. My kids are a pain in the neck. My wife doesn't listen to me, and I got some swelling in my feet. This is who you are.
So you listen to the body.
I listen to all of it. And I also listen to your story, and I get more of your story. In other words, what I just said is, you come and say, my neck's bothering me. I'm going to ask about your whole life. Because, again, your neck's bothering you because you had a car accident. It's one thing. Your neck's bothering you, you had a car accident, but your father also died. It's a whole different thing. You can't separate the emotions from the physicality. I don't have the cure for your father died, but that leaves a mark on you. Everything that's happened to you is written everywhere in your body. I'm not a psychic. Your secrets, they remain yours. But I can feel how you feel.
Were you an empathetic kid growing up? How
I
want to understand your personality now, because it's quite intriguing to me, because you are a good listener. That means you're a great listener because you're listening to a lot of things.
I'm a listener and I am empathetic about a lot of things. I'll tell you from my growing up. I don't know why. I've always been kind of really sympathetic for Down syndrome kids. Down syndrome. When I was young, we make fun of them. We say things. I said bad things because other kids were doing it. Inside, I felt sick saying it. I feel really bad. I want to do something for them. Okay. Before medicine, I did martial arts for 20 years.
Wow.
Yeah, 20 years. I had a class. I would teach kids from 5 and up. I had a class. I had a little boy, 6 years old, Christopher, and he was able to do things. Kids are fun to teach. Christopher was able to do everything, and his brother, who was 8 years old, Danny, would come to class and watch in the chair. Okay, this is my karate days. He would watch in the chair and he'd mimic the motions. And like a lot of Down's kids, they're always smiling and kind of laughing, in addition to being hyperactive. So Chris is a student. I'm teaching him. He's learning. His brother's trying to mimic him. And I said to the parents, I said, you know what? I think I can teach Danny. You don't have to pay me for Danny. Just bring him into the class. I want to teach him. In 3 months, it took him longer to learn than the other kids. I can't do it on camera. In 3 months, he was able to lift one leg up in the air, jump and kick with the other leg, and land on one foot. And able to do a lot of coordinated things. The parents came to me and said the change is so dramatic in Danny because in the United States, they're mainstreaming these kids. So they would he's high functioning. They would put these kids in classes with kids who are doing stimming and not speaking, like very severely handicapped kids, all in the same class. So he would come back mimicking worse behavior. They said he would never ride a bike. He rode a bike in 3 months. He could never balance on one leg. I just told you, he could jump and kick with one leg. And he could never do a pogo stick. Where they even get that idea? You know what a pogo stick is? Who even thinks of that? Anyway, he was able to do all those things. And then the parent said to me, you know, maybe you could introduce this to the school. You've had such good success with Danny. I said, I would do that for nothing, just to be the guy to do it. They wouldn't even let me speak to them. Why? Because I'm a karate guy. I'm a nothing. I'm a hamburger flipper in their mind. And you think they're going to let me show PhDs how to make them look foolish, which was not what I'm interested in. I just want to see if I can make the difference. But I definitely had a soft spot for kids like that, and kids in general. There's a lot of things you can do. I've got autistic kids to speak that never spoke.
Wow.
I don't want your listeners to think that Dr. Sanet touches everybody and everyone's healed and everything's well. No, sometimes there's small miracles, sometimes big ones, sometimes nothing. But what does medicine have to offer those kids? Nothing.
Yeah.
It's not that they're bad, but if you go to a surgeon and say, well, what do you think about my case? Well, a surgeon does surgery. So they look, are you a candidate for what I know how to do? No, I'm sorry, there's no help for you. So medicine is good when you need it. When you don't need it, it's not a vitamin. Yeah. And I look at manipulation the same way. Going back to what we said earlier about people that are predatory. You need to come in 3 times a week. You're on the 3 times a week program. No, you're making people dependent on you. Not just physically, but you're making them emotionally dependent on you. That is so wrong in so many ways.
So like you mentioned about dependency, there's a lot of things happening around physiotherapy also that people are forming that dependency in India. I want to know another thing, like why still osteopathy has not become a mainstream process in India? What is the reason for that?
It's a new thing in India.
Okay.
PT, physical therapy, has been around for a long time. It's established in everywhere around the world. Osteopathy went from America to Europe, and it's only slowly crawled to Asia. And I will say that I've been one of the first ones to spread this around Asia. I've been coming to Asia since 2000 in Korea and then Hong Kong, and I was probably one of the, I'm sure there were other people before me, but when I came to India, things got real big real quick. So it's kind of new for people. I mean, where I'm from in the United States, osteopathy was born there, and no one knows what it is because we are licensed like same as the physicians. You can be an osteopath surgeon, osteopath neurosurgeon. So they go to their family, they come to me, they don't really understand what I do, but I treated their uncle and they're like, we heard that you helped him, can you help him? Oh, then they get to learn, D.O., you're an osteopath. My family doctor's an osteopath. How come they don't put their hands on me? I have no answer for that, except that they got absorbed into the MD world in the United States. So most people are shocked. They don't really know. Now in India, I'd say I've been coming here since 2014, and we grew pretty fast as far as our group. And myself and our college, we have 40 programs in 30 countries. So
wow.
Yeah, so if you Google osteopathy, my name's going to come up, our college will come up. And so I think things have grown a lot in India.
Yeah.
Personally, for me, I enjoy being here for a variety of reasons. One, when I'm speaking here, most people, at least in Delhi, Mumbai, English is okay.
Yeah.
It gets rougher if I go south and so forth. Also, your education level is very high. And I can say that because I've been to 80 countries. So Indian students are very adept, very perfect for learning osteopathy. And the other reason that I like being here, the big reason for me, is you need it. You're 1.4 billion people.
Yeah. Yeah.
Okay? So I teach in Switzerland. In Switzerland, in the US, in Canada, osteopathy is a good choice. Surgery, medicine, maybe hands. They're the least risky and the most cost effective. It's another choice for us. In India, it could be the only choice.
Yeah.
Okay? You're uber wealthy here? Well, we don't have to worry about them. They fly to Europe, they go to the States, they'll get whatever they need. And you have a class of those people here, and you have a giant class of people that can't afford these things. The other aspect is that the person, the physical therapist who becomes an osteopath, as I said, they can do all the musculoskeletal things, which is what PT is mostly known for, musculoskeletal, neurologic. But now they have an approach for cancer, disabled children. Approach means you have something you might be able to offer them. You might be able to help them.
Wow.
And your country needs it. US doesn't need it. We have it.
I'm finding some kind of a similarity I want to know from you. Like, this seems to be an ancient technique that you are also using. This seems to be deeper than the science that we read. This seems to be more around touch, feel, and reading. So in India, we also have something called Ayurveda and yoga. Are there any parallels here?
I wouldn't say battles. I can't really speak about Ayurveda because I don't do it.
But I've heard people reading through nadi, the pulses. Is there any similarity?
No, I'm not reading pulses.
Okay.
I'm reading tissue, but not reading pulses.
So
I know what nadis are. We're not doing it in that way. So body work.
Because I want to understand the contrast, the differences, so that people don't compare, correlate wrongly. So if
the differences between osteopathy and what?
Ayurveda.
Okay, again, I don't do Ayurveda, but if you're going to someone who's going to read your pulses and then prescribe Indian types herbs and medicines and things like that, that's not going to be the experience with a non-medical osteopath, which is most of the world. With me, I am licensed also for medicine. You go see an osteopath, some people are going to be protocol driven. You have back pain, so we should do this, that, and whatever. And a much smaller group is going to say, well, you have back pain, maybe we can do this, but I'm feeling other things in your body that are not working right. They all have to contribute to your wellness. Your body, unlike the United States government, does not understand deficit spending. It spends what it has. Okay? So if your back's hurting you, it's going to change the way your legs are, the way your shoulders are. Maybe you're only complaining of back, but I have to address all these issues. Some I can see and some I can feel.
Also, what is the impact of poor mental health on the body, and is there a correlation that you can read in osteopathy that a person is suffering through something in mental health?
Totally. The simple example I gave you was, you have a car accident, you hurt your neck, or you have a car accident, and your father died that day. Okay, these are not the same event at all. You cannot separate. When I graduated medical school, which is 30 years ago, okay, yeah, I'm that old. 30 years ago, it became very popular saying holistic medicine and mind-body medicine. We do mind-body medicine. Really? Go to Dr. A, Dr. B, Dr. C, you're getting the same thing. There's no mind-body. Realistically, we cannot separate what happens to you mentally from what happens to you physically, and vice versa. And I'll give you an example that you'll understand. You're a pretty young guy, at least anyone younger than me is a young guy. So one of your friends asks you to go help move some furniture. You're going to move his apartment. And you lift something and hurt your back. There's a certain emotion that goes with it. You're like a little irritated. Why do you have to help your friend? And now I hurt my back. That's what I get for helping you. Okay. And you had a party to go to. Now you got to go to the party in pain. Well, normally, if you're 20 years old, you hurt your back and then it gets better. A couple days, it doesn't get better. It stays exactly the same. And you still have to work. You still have to go to school. Now you're getting more irritated. Your emotions change a little bit. So you go to some of your friends, if you're a PT, and have them treat you and work on you. You expect to get better, and you don't. After 2 weeks, now it's not funny anymore. My back hurts. It's never hurt for 2 weeks. You start to get a little frustrated, maybe even a little angry that your friend had you do this. So you say, I'm not talking to my friends. I'm going to the teachers. I got to get fixed. You go to the teachers, and you go to all of them, and it's a month later now, and your back is exactly the same as when you lifted that couch. You have a new emotion. What is it? It's fear. Okay, fear is a primal emotion.
Yeah.
A baby is fearful, angry, happy. A baby's not disappointed. That's a meta emotion built on other things. When a toddler takes a cookie and gets caught, he doesn't feel guilty. A toddler's a psychopath. They don't have those emotions yet.
Yeah.
They're mad they got caught. Now you feel fearful. What if it never changes? Now you fly to the States, Dr. Sanet, treat me. You go here, there, and it's not better at all. Now you are the person who will always have this pain, and you accommodate to it because you've been to the best and they told you, if I can't fix you, this is who you are. So the emotions have just melted over time. And I used to say to medical students when they were in my office, and I've seen this, someone who's had a headache for 20 years, debilitating their life. I treat them a few times. I get lucky. The headache goes away. What's the emotion from the patient? Can you guess?
I think it is regret or something like that.
No. If I ask the medical students, they'll say, oh, the patient's happy. Dr. Sanet, you're wonderful. Oh, thank you. No. It's disbelief. Because I'm told I'm always going to have this. This is not real. I had a lady, very, very, very wealthy person, come into my office with a headache for 17 years. Went up, went down, never went away. She came in, insulted me for at least 5 or 10 minutes, said I wasn't a real doctor. I mean, she just let it all out. I'm fine because she's going to pay me, so you can insult me all you want. And finally, I said, why are you here? Oh, well, my son said I should come here. Well, who's your son? He's going to this prestigious medical school. He's going to be a trauma surgeon, real doctor, not like you. She says this to me.
My God.
Hey, buddy, I got thick skin. You can't hurt me. So she lays it down. I treat her, and then I see her, like, I don't know, 5 or 6 days later, next week, something. She comes in. I said, how you feeling? Same. Gives me that dead-eye look, a little angry. I said, same. Yep, waste of time coming here. Waste of time, waste of money. I said, really? I said, and I'm like, 30 years old, 32 years old. Take one finger and put it on the spot that hurts the worst. This is not a crazy person. It's not a dishonest person. This is an average person. Average, very rich person. Take one finger, put it on the spot that hurts the worst. And she said, well, it's not hurting now. I didn't laugh at her. I didn't make fun of her. I said, was it hurting this morning when you got up? No. Was it hurting yesterday? No. You had a headache since I saw you 4 or 5 days ago? She said, no, but it's not from what you did, because you didn't do anything. She told me this. And I said, okay, well, I go back in the history. Since she had a kidney removed, she's had a headache for 17 years. I said, you told me that it's never, ever gone away. You never had a vacation from your headache. Is that true? Yeah. She came to me for about 2 years, threw money at me with no problem. Okay, if you come to me, it took a while for her to realize she didn't have to have the headache, that it wasn't a fluke. A couple of days, she said, this is not real. After a couple of weeks, she kept coming to me. I'm like, you're okay, you don't need to come. If you want to come and throw money at me, start throwing, okay? But I don't make people dependent on me. So she would just come, I want you to just do a treatment and look at me. Okay, fine.
Wow.
Money doesn't matter to you. So my point is that the mentality changes because of the physicality. And also other people telling them things. You're a doctor, a chiropractor, acupuncturist, physical therapy, Ayurveda. You're somebody that they respect, and you say, you know what, this is never going to get better. That's a potent bad pill to give people.
Yeah, true.
I never say that, nor do I lie and make false expectations. You guarantee you're going to help me? You're going to fix this, Dr. Sanet? I don't know. I'll do a couple treatments, and then we'll talk with each other and see how we're at.
We'll see.
Well, this is expensive. I don't know if I want to pay for this. I don't know what to tell you. Can you guarantee me? No. The funny thing is, the surgeon can guarantee you nothing.
Yeah.
And if he makes you worse, they accept it.
They accept
Well, it's a risk of surgery.
Yeah. People have accepted that idea.
Yeah, but for some reason in body work, touching people, it should be a money-back guarantee.
Yeah.
I'm like, no. Let me tell you right now that you're not getting that.
Yeah.
What you're going to get from me is I'm going to treat you to the best. I'm going to do everything I know how to do to help you.
So I think we've accepted the process of surgery. We have not accepted the process of hand. Something like that, maybe.
They have an idea that this is a a guaranteed thing, or it's refundable, or it's half of a. If it's half of a ripoff, they feel the con. Okay, when someone says, "Well, you're going to need 30 treatments to get better," no one in their heart believes that.
Yeah.
Okay, so the way I started from the very beginning was my plan: couple of treatments, 3, 4, 5 treatments. If after this treatment you feel 90% better, call and cancel. No contract, no nothing. That's an easy sell.
I want to understand from you how important is strong mental health or mindset for recovery.
It's imperative.
Okay.
If I break your body, you can recover much easier than if I break your mind. If you have severe mental issues, it's imperative. We can't always change that, but I've seen a lot of people. I actually had a lot of patients who are psychiatrists and psychologists end up being patients. Well, I guess what they got to hear all day long. And I'm hearing the same thing. It's half psychiatry because I listen to them. And I had a lot of these people, and then they would send me their patients. And some, like severely mentally ill patients. I had a lot of people with multiple personalities.
Oh, really?
Like you see on TV.
Yeah.
And I'm like,
switch.
I would just ask them, I'm like, well, how's the patient doing with you?
Oh.
They're like, yeah, they're moving much better through therapy. And I like this aspect of medicine. It's people with severe depression, severe anxiety. I'm not taking over their mental care. They have a psychiatrist, psychologist. No. I'm secondary. But if I can help their body to feel better, it's a component. Your mental health is not separate from your physical health. But it's imperative that we get you feeling better.
I want to understand a deeper level about this. Like we have understood how it works. Like strong mind is needed. Mental health is very important. In osteopathy, what is happening? What is it that you do? What is happening inside the body? How is it healing?
Well, our philosophy is that the body can heal itself if we can support it in the proper ways.
What is that?
In the first time I meet you, and you tell me probably some musculoskeletal thing, I ask you other questions. The number one reason why people see any physician treatment, whatever, is back pain, low back pain.
Yeah.
Number 2, statistically, everywhere around the world, is from here up. So we can say headache and neck pain together.
Yeah. In
the North American population, 20 to 25% have irritable bowel, which means they have diarrhea, constipation, one or the other,
IBS.
and a negative colonoscopy in the West. Here it might just be on symptomatology. And then I ask about sleep, problems falling asleep, staying asleep, or both. So headache, neck, back, bowels, and sleep. And people are probably going to be, the adult patient, probably going to tick off 3 boxes. These are all wrapped together with your mental state of being. If you're having physical problems and you're not sleeping well, probably. If I can get you sleeping better, the physical problems get a little bit better. If I can make it so you're not having a bowel movement every 4 or 5 days, your outlook on life is going to radically improve. We're not separating the physical from the... When you say strong mind, some of us are stronger than others. Let's just say healthy mind.
Healthy mind, yeah.
You know, we're all stressing about different things. Same things, family, health, money. And some people are caught in a loop. They can't get out. Some of the things that I would say that I've done for people is I listen to them. I've had some significant treatments. No one's ever listened to them.
That makes a big difference.
You know, I've been on both ends of it. I've been really sick, told that I'd be dead in a week.
Oh.
That was 30 years ago. That's more to the story. Okay, so I've been on both ends of it, and I've seen people that should be dead tomorrow. Magically not, and there's not the explanation for it, but I was involved in the treatment.
That is what I want to understand. What did happen with your touch work? What did change? Like how? Because it's quite magical to understand. Can you break it down a bit for me?
I can. For me, it's best to break it down with a story.
Okay.
It's going to be a 5-minute story.
Yeah.
I'll tell you the best and worst day of my life in medicine.
Okay, let's do that.
Best and worst day of my life.
Yeah.
When I did an undergraduate fellowship, which means I'm in medical school, not graduating yet, but they offered a scholarship. You want to spend another year in school? And we're going to try and make some people out of this class an actual osteopath. We'll pay for your last 3 years of medical school. It's a scholarship. I needed the money. It wasn't that I wanted to do more manipulation. I needed the money. So I started becoming proficient in making sure the teacher knew who I was. So I did this fellowship, and I got good pretty quickly. I felt competent. You got a back pain, you got headaches, you got whatever. I started learning everything I could. There's the physical things, which spinal manipulation is very mechanical, very scientific. And then other things are energetic, and I can give you an explanation, but it requires some belief. You don't have to believe it. Doesn't matter what you believe as a patient. I don't talk you into being well. Yeah. So I got very good at the esoteric things that are hard to prove, although I can prove it, but it would take a long time on camera. Energetic things, a lot of it is provable. Anyway, so I got very good. And with my teacher, we became buddies. That was a bad idea, but we became friends. And so I'm the special student. I'm the prodigy. So I would follow him around after class at night. He would treat people, and I would go with him. And I would see people in the clinic on off hours. And I can say this now because we're past the statute of limitations. As a student, you can't take money for that. Well, I did, okay? A starving guy, you can't really threaten too bad. Yeah. So people would be at the clinic, they'd be like, hey, can you come to my house? This is 30 years ago. And I said, no witnesses, $50, I'm coming to the house. Okay? I don't come from a rich family. So I saw people on the side, and my teacher took me around. I'm the guy.
So you got hands-on practice.
Oh, yeah. And my teacher, he was very talented. He kind of taught us like, you're very good. You're not going to be as good as me, but you're very good. Taught me kind of in that way. When I was a karate guy, I trained guys who fought at the casinos back when there's no money in it. And if I taught you how to punch and you clocked me one in the face, I didn't get mad about it. I'm going to get you back. But I didn't get mad because I taught you and you beat me on it. I want you to be better than me. Okay? So my teacher, we think oh my God, he's everything. He brings me to a house, and he brings me to a house of a guy who fell off a roof after the hurricane in 1992. He was cleaning his roof, fell. When he fell, he broke his back. He shattered his back. What happened was he had multiple myeloma, which is a blood cancer that was in his spine. No one knew it. When he fell, the spine was so fragile, everything just shattered. So at the time when I'm seeing this guy, and I wrote about it in one of the books, when we're seeing this guy, this is the kind of guy that would scare me as a student. Like, you're looking at him, all you got to do is blow air on him, maybe he'll die right in front of you. I'm still a student. But I'm there at night with my teacher, so it doesn't matter. We're covered. And here's another thing. If you're bedridden for 6 months, you can't sit up. It's too painful to be on the discs. And he had fractures everywhere. He's end stage. He's going to die. So I would go with my teacher, and he's in such pain. Before we would do some manipulations on him, my teacher would give him maybe 10 milligrams of Valium IV. Now, let me tell you something about medicine. There's a reason why people abuse IV drugs. If I gave you 2 milligrams of Valium and you're not used to it, you're going to sleep for a while. Wow. If I take 2 milligrams and shoot it in your veins, you're high as a kite. You're on a planet far, far away. Instantly. He's giving him 10 milligrams. Now, you have to understand how medicine works. If I give you a medicine like that and there's nothing wrong with you, you're going to get high. If you've got a lot of pain, pain is competing with the high. You're not getting high. We're just trying to control your pain. Yes. This guy's in such bad shape. So he gave him 10 milligrams of Valium, and then we would take a needle this big and stick it in his spine 6 or 7 times at different levels to give him anesthesia at these levels. When we touch him, he's in such pain. This shouldn't be being done at someone's house. Okay? But again, I'm not in charge. My teacher is. So, whatever. And we treat him, and as we treat him, which is my teacher saying, Steve, do this, Steve, do that. Okay, I'm doing something. And when we're done, we would get him to sit up for like 30 seconds, and he'd be screaming in Danish, "O for Jægla." And I said, what does that mean? He's like, damn it to hell in Dutch. So he'd be screaming, and he was about late 60s. Got the picture? Oh. So my teacher every year goes back to the state where he lives in May, and he tells me, we've become buddies now. He says, I'm leaving, so I want you to go treat Bjorn by yourself tomorrow. Tomorrow, go treat him. I go, no way. Go there by myself? If I fart on him, he's going to die. He goes, well, if you don't, he'll probably just die if nobody cares about him. That works on me, that stuff. He's going to die in 2 months anyways, end stage multiple myeloma. And I said, all right, I'll go. I said, he said, I'll leave all the injectables there. I said, I'm not injecting anything. I have different levels of breaking the law that I'm comfortable with. So, I'm not graduated. So I show up at his house. He's laying in bed. We look at each other. Neither one of us is very confident about what's about to happen here. And I said, Bjorn, look, boss isn't here. I'm not injecting you with anything. Just do what I can do. But see, I'm not working under my boss now. My boss was the one. He knows everything. You do this, you do that. So I just work freely. And I'm doing what I do, feeling and doing different types of manipulations. Not hard things. You can't do it to him. Okay? Touching different areas, feeling organs, doing things like this. I do this for like 45 minutes or so. I get him to sit up for 2 minutes. No screaming, no Ofer Jägler, and no drugs on board.
My God.
Why?
Why?
Because I'm great. That's why. This is the greatest day of my life. They're going to be making statues to me in town. The president will be shaking my hand. I told you, best and worst day of my life. So, and I'm showing him some breathing exercise that he can do in the bed. And while I'm showing him, wow, this has just been a great experience. Okay, I'll see you, Bjorn. I'm going to go. And I go to shake his hand. The tongue comes out of his head. He's crushing my hand. He's in a full body spasm. And I won't say on camera what in my mind I said. My life is now officially over. He's going to die right in front of me. I'm a medical student. My teacher's off somewhere else.
My God.
And I knew this was going to happen. I knew this was a mistake. And then his sister comes in. He's in his late 60s. She's in her early 60s. What's wrong with Bjorn? Like, I don't know. He's stroking or dying or something. I'm a bad liar. Just call 911, call the cops, whatever you got to do. My life is officially over. His mother comes in. She's in her 90s. She's got all her marbles. She's sharp as a tack. What happened? I'm like, he's dying. I don't know. Call the ambulance. They called the ambulance. And did you ever see the movie Something About Mary? A very embarrassing situation happens to a young man. This is what's happening to me. So I can feel just my life is just over. You know what? I'm going to call my teacher. He said he was going back home. I call. He answers the phone. I said, you sent me up here? I'm in deep trouble, man. You better get here before the popo gets here, the police. You better get here before fire rescue gets here. Get here. And he didn't live that far. Yeah, he doesn't get there. She gives me the phone. Hey, it's an oncologist. Cancer doctor wants to talk to you. Hi. What'd you do? I did some light touching things, lightly. Well, you probably just moved the plaque to his brain, but he's going to die anyway. I feel so good about myself right now. I killed the SOB, or at least I think I did. And they take the phone from me. Fire rescue's coming in. It's like that out of a comedy movie. They're coming in with a stretcher. His hand's still out here like this. Like this. God. And I'm just like, I can't even, I'm just frozen. I said to the mother, I said, they're probably going to arrest me. I said, I'm trying to help him. I didn't get arrested. Nothing happened. They took Bjorn away. Went straight into the ICU. My wife, my first wife, got close to that family and close to my teacher, and this was all a bad situation because they're all into this spirituality kind of thing. And so she's visiting him in the hospital. She says, you need to visit him in the hospital. I said, I can't. I put him there. I can't face him. Family wants to know why you're not going. I can't. Now, here's the thing. Oh, he went blind. Bonus. Okay? So, he's in the ICU for 10 or 11 days, 12 days. His vision came back. Typically, when the occipital lobe shuts down, it'll shut an eye down if it's not working. It doesn't come back. It came back, and he was in the ICU for about 20, 21 days. He walked out of the ICU without a trace of cancer. It's not a case I'm making up in my mind. There was the thick medical record from his oncologist without a trace of myeloma.
Thankfully, the AC is on. Yes. What happened? How did he come out of it?
Well, what he said was he felt that this all happened in that treatment. And after he came back, he hadn't walked for 6 months. Not a trace of cancer in his body. His IgGs were off the charts and things were normal. He invited me back over to the house. He said, I want you to treat me. I said, Bjorn, I love you. I'm never touching you again. I can't take it. Okay? Bjorn lived cancer-free for maybe a year and a half, had a relapse, and was dead in 30 days.
Oh.
Again, I don't answer the spiritual questions, the why, the what. What I do know is cancer can be turned on one day, turned off another day. Am I the guy who turns it off? I'm not saying that. There's another aspect to it, okay? And priests and imams and temples are trying to answer these questions. I don't. I just know that you do have the ability to be well. Whether or not you're going to live or die, some other deity is in charge of that. But if you're asking me, Steve, will you help me? I'm all in. I'm 100% in. And there's things that maybe get mobilized, things that maybe get turned on when other tissues are released, when you can let go of other traumas. You can't forget the terrible things that have happened to you. None of us do.
But that half an hour of treatment got him back out of that.
He says. What I can say is he wasn't taking any medicines. He was very anti-medicine. He was doing other types of alternative things. But when you ask me about mental and physical, the bad physical things that have happened to you, they don't get erased, but they don't have to keep making the decisions for you.
So do you also get to read while you shake a hand, or how is it? Like, I want to understand how powerful is the thing that you have, because you can read things, I believe.
There's nothing that I can read that I couldn't teach you to read.
Can I also learn?
Well, I mean,
I feel you're made different for that. Is it so?
We all have different talents in certain places, right? As far as music, artwork, so there's probably some starting level, but it can all be enhanced.
Okay.
When I talk about small touch, I'll explain it this way. You put your hand here. Let's go back in time to when I was 17 years old. And for some reason, keep your hand there. For some reason, I'm sitting next to you, and we're going to change you into a 17-year-old, very beautiful girl that I'm interested in. And if accidentally one molecule of me is touching one molecule of you, we both know it.
Yeah, true.
If you don't pull your hand away, it's because you are madly in love with me.
Yeah.
This is how every man thinks. Okay.
Yeah.
So from the very smallest touch, we are aware of things. We just tend to discount it. I'll give you another example. Are you married?
This is a very good example, yeah.
You're married, right?
Yeah.
I'll give you my own example. I'm married. I come home. Hi, sweetheart. How was your day? Fine. How's my wife? Is she fine? No. She's the opposite of fine.
Yeah.
Am I going to figure this out? No. Is she going to tell me? No. Is she going to let me drown? Yes.
Yeah.
It's in the tone.
Yeah, it's in the tone.
I ask you, how are you feeling? I'm asking you, how are you feeling?
Feeling good?
Very good. We'll do it again. How are you feeling?
Feeling good?
What's wrong with him? I don't know. I think his kids are in trouble and his wife's cheating on him, blah, 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 blah. We do this all the time.
Yeah.
Okay?
We overread.
Kids and animals are very good at this.
Yeah.
Okay? If you have animals, you have dog or cat, something sad happened to you, the dog's coming around, they know you're sad. Dog poops on the carpet, can't find the dog. Okay? So I train people to do what children and dogs do naturally.
Wow. So
the problem is we feel something, we start trying to change it. Well, my professor said it should be this. The protocol said for back pain I should do this, this, and this. And we try to make it fit a mold when the information is being given to me. I know protocols. I know what to do for back. But how I'm going to approach you, I don't know until I touch you. I'm going to find where the deficits are. Maybe I can change them, maybe I don't. But I can feel things. I don't challenge what I feel.
But you know how to read what you feel.
It's not a how. I just feel it. There's no how. It's living in the now.
Living in the now.
Okay, adults.
But you have to also make sense of what you're feeling. You need to have some knowledge about the feel.
I have plenty of knowledge.
Yeah.
That's one half of your brain. Feeling is another half of your brain.
Yeah.
You're not doing both at the same time.
So you're feeling separately and then you process it later.
It's happening at the same time.
Amazing. I think that's a crazy kind of an algorithm.
We've been trained to make things fit into a picture. And if it doesn't fit, we bend it and make it fit because the teacher said it should be this.
Correct.
But the reason why I'm so free to do this, it's not because I'm cocky. Maybe I'm a little bit cocky from my experience. But if you come to me, like this lady came and gave me 1,000 insults, okay? You think I'm the first person to see her? She's uber wealthy. She's had headaches for 17 years. I guarantee you she's seen the best of the best. So she's certain I'm a dummy. Fine. She's going to pay me, and the dummy needs money. So I'm okay with the insults. But if I help her, oh, she thought I was the greatest thing.
Yeah.
If I don't, she thought I was a dummy before. She can keep her same opinion.
Yeah.
And if I fail, there's 100 people behind me that also didn't figure it out. So I don't have any pressure on me. I'm not thinking about me. I'm not thinking about my record. Gosh, this has to work or I stink. Okay? I'm just in the moment, me and you.
Yeah.
For me, I don't know why that's been easy for me to do, but it has been easy for me to do. The rest of my life, I walk out of work, I put all my troubles on like a backpack. And I sleep poorly and I think about things constantly. Patients would say to me, like during the treatment or the way that I work, Dr. Sanet, you're so calm. I'm like, really? You want to come to the house for dinner? You know, do you meditate? I'm like, no, I can't even sit still. But when I'm with you and put my hands on you, that's my meditation. It's like Bushido, the code of the samurai. It's attention to detail to whatever you're doing in that exact moment. In the moment where I'm touching you, I'm free from being Steve Sanet. It's exhausting being Steve Sanet. I have too many responsibilities, too many things. You know, same things everyone has. Money, health, blah, 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 tragedy. I've had more than my share of tragedy.
Super.
The moment I put my hands on you, I'm not thinking about myself at all.
I want to know one last thing from you is, in your decades of experience, have you seen that technology is damaging us further?
Technology?
Like too much of technology is there, like we are now consumed by the mobile, a lot of cervical is happening, a lot of posture issues are happening. So is technology definitely like escalating the problems that we have?
Absolutely. I go out to, my wife and I, if we're together, we're not on phones. We watch TV. If I get up to go to the bathroom, she gets on her game. She gets the next level. If she goes, I'm just checking messages because I'm in 30 countries regularly. But when we're together, no. Phones are down. Phone, it's good and it's bad. Without the advent of email, I probably wouldn't be able to be here.
Yeah. If
I had to make an overseas phone call and send letters. So it's been great. But I've managed to hold on to at least the generation that I came from. I have no problem reading. I have no problem putting the phone down, listening to music, going outside. The generation that I see now, I see 4 families, I see 4 people at dinner on 4 phones. Why even have the meal together?
Yeah.
My wife likes to say, she's very crystal clear about things. She said, if you're looking at pictures of a wedding that you weren't invited to, and you're surrounded by your friends, there's something wrong with you.
Yeah, right.
So when I was a kid, they said that we're watching 5 or 6 hours a day of TV. We came home from school, we watched the cartoons, we went out to play until the sun went down and our mothers were screaming for us to come home. Now they're getting 10, 12 hours a day of doom scrolling.
Yeah, doom scrolling.
Aside from the doom scrolling, It's also, wow, everybody's having so much fun on the internet. No, they're not.
Yeah.
Okay?
Yeah.
No, they're not. You get this artificial thing. So you're getting kids committing suicide, live streaming it.
Yeah.
If they didn't have the live stream, maybe that wouldn't be happening.
Yeah.
You're having, there's other motivating factors, I believe, money and politics between all this gender dysphoria now. There wasn't these kinds of, large percentages of kids saying, I'm in the wrong body, I'm this, I'm that.
Yeah.
But, you can find a group of people that are disaffected like you, that are doom scrolling all day, and find someone who says, I know what's wrong with you, and here's what it is. Here, you're in my group. And so everyone's losing control today.
So it's too much of technology.
And yet, maybe they'll find some more cures for cancer and other things that we need. The problem isn't the technology, it's the parenting.
Parenting, yeah.
Okay, but if the parents are in control of the technology, you got a better chance.
So is it also like, because post-COVID, every school now involves computers, mobiles in India. I'm talking about India. So do you have any suggestion for parents or kids? Because it's too much of technology post-COVID, because people could not go to school. Now schools love using technology. They do it at home, do it on your laptop. So it's young kids, 12, 13, 14, too much of laptop, mobile. Any suggestion, anything that you have for them? We'd like to close on that note, that some people, parents or kids watching this, what can they learn? How can they improve?
I mean, one, you can limit screen time, but then you're going to have to find something else for them to do.
Yeah.
And you could say, go out and play with your friends, but their friends are on their screens.
Yeah.
So unless everyone decides to do it, or you find groups of people, I would be terrified to be a parent now, today. But, find groups of people that might have similar interests. I would say that from the U.S. perspective, I can't speak about India, but people are becoming more secular, and that's a problem. I don't want to live in a godless world.
Yeah.
Okay? So, and regardless of how people see their spirituality, I think that needs to be a part of their lives. And if you're someone who doesn't believe in that, and you're an atheist, I would say then you need to believe that your life matters in your interaction with it. You don't want to believe in a higher power? Fine. But you need to believe that your interaction, you touching another person, matters. So spend time with other people. But it's going to be hard for parents, because the technology is just invading them. It's perverting them. You can't seal off pornography from anyone.
Yeah.
Okay? They're just going to do workarounds for everything. Things that was just unheard of in my day.
Yeah.
And if it was available in my day, I would have looked for it, like any other 10, 12, 13-year-old.
Yeah.
But it wasn't possible.
I think we're living in a very difficult time.
It's a very scary time, actually. But I do believe that one person can make a difference.
Yeah.
It can't change the government. It can't change a lot of hateful motivations and things that are going on in the world. But what you do for one person, I really believe that's the whole 6 degrees of separation thing. The charitable thing you do for somebody might change them and change a few more people and change lives. And even if it doesn't, and nobody ever says thank you to you, maybe you just do it anyway. Because the only currency you have, if you believe in past life, future life, or just here and then heaven, or you believe in nothing, the only currency you have is your ability to love, to give it, and to receive it.
Yeah.
You're not leaving here with your good looks, your money. But if you didn't like people because they were a different color than you, it's probably not healthy for you. If you believe in rebirth, then you'll be born as a black person or a white person or whatever. Until you figure out that hating people based on that, probably not healthy for you. So if what we are is greater than what I can see right now, then it's your experiences here.
Yeah.
You're either loving or you're not loving. If you want to say light and dark. I don't believe in dark as a power. I believe in not being near the light.
Yeah. Superb. It was a great conversation, Dr. Stephen, and I'm mesmerized, and I'm glad I could meet you.
Oh, pleasure's all mine.
Thank you. Thank you for so much for coming to the show. Thank you.